Hey everybody, so today I'm going to do a discussion or a lecture on injections. So I know some of you, when you were in school and we had the start of the pandemic, we closed down our labs and you were unable to come to the school to physically practice injections. So I am going to give you some notes on injections. I have a Word document that has a couple diagrams on it that I'm going to upload in your announcements, and then I'm going to show you how to give the injections. So I'm going to kind of go through each step. I'm going to move my computer and kind of show you each part, but I want to talk about the basics first. So I have a couple things written on the board here. For injections, you have the three main types. Okay, so you have your ID, which is intradermal, and hopefully you guys can see this close enough. I'll bring it up a little bit. So you have ID, which is intradermal. Intradermal is just under the skin. So all you're doing is just going under the layer of skin into the dermis part. So we usually do the forearm area or the back, and it's usually upper back. And these intradermal injections are usually used for TB tests or they're used for allergy testing. What you're looking for is you're looking for a wheal, that circle, that bubble, after you inject whatever you need to inject into the patient. You're looking to see if someone has either been exposed to TB or if somebody has an allergic reaction to something. So you're going to give them several different samples and see if they react to it. The angle that you want to hold your needle is a 10 to 15 degree angle, and I'll show you that when I have the needle in my hand. So I said the sites for the forearm or the upper back. What's important to know is a usual dosage, needle size, and gauge size. So needle size is the length of the actual needle, okay? So we have an intradermal needle right here, okay? So when I show you how to give this injection, this is your syringe and your needle is at the end here, okay? So your needle has to be a certain length. It also has to be a certain gauge, which is the diameter of it. So your needle size would be a 1/2 inch to a 1/4 inch, or your gauge would be 26 to 27. So the bigger the number, the smaller the actual diameter or gauge, okay? Dosages are usually under 0.5 milliliters. And I put some examples of the tests that you're going to do. You're going to do a TB test or an allergy testing. Okay, so that is your intradermal. Your sub-Q, which is subcutaneous. Sometimes when you take your test, it just says SQ, and that means sub-Q or subcutaneous. So you may see them written as just ID, IM, or SQ. So you'll need to know what that means when you're reading the question. So sub-Q is subcutaneous. This is in the fatty layer, okay? So you're going under the skin into the fatty layer before you hit muscle, okay? So this is kind of meant for like a slower absorption into the body. So the sites would be either the outer thigh, the back of the upper arm, kind of that fatty part back here, or the abdomen. Now, somebody who has to give themselves an injection of insulin every day is going to be doing it subcutaneous, and they will have to rotate those areas because you're going to develop scar tissue if you inject into the same spot every time. So that's something you may have to tell your patient. They may ask what that means or how to do it. Sometimes we show them how to do it, and then we have them do it themselves so that we know they understand. So needle size is a 1/2 inch to 5/8 inch. The gauge is 25 to 27, so a little bit of a thicker diameter, a little bit of a wider diameter. Sometimes the liquid can be a little bit thicker. And you're going to hold the needle at an angle of 45 degrees. Now I put here 90 degrees on an obese patient, because if you have an obese patient, you will never get into that fatty tissue if you're going 45 degrees. You have too much to go through. You may also have to use a bigger needle, a longer needle. So sometimes when it comes to subcutaneous injections and intramuscular injections, you have to judge the patient's body size or their body habitus. You may have to change your angle. You may have to increase the needle length. So depending on how large that area is that you're going into, or how small. You know, if you had a tiny baby or a smaller child, you're going to use a smaller needle than recommended. Examples are insulin, the MMR, which is the measles, mumps, and rubella vaccine, epinephrines given subcutaneously, and heparin. So those are some examples of medications that are given this way. So that is your subcutaneous. I'm going to move over to intramuscular. And hopefully you guys can see that good. So your intramuscular means into the muscle or within the muscle. I have a glare. Looks a little better. Your sites are your deltoid, which is your upper arm. Right up here is your deltoid. Your vastus lateralis is the outer thigh muscle. And ventrogluteal, which is your buttocks or your butt. Okay, so there's different sites, different places to give these medications. Needle size is 1 to 3 inches. And again, that's just what's recommended. You may have to use a longer needle on a very obese patient. I've worked before where someone had to use a spinal needle to give an intramuscular injection because your patient was over 500 pounds. And there was no way you were getting into that muscle unless you had a larger needle. Sometimes you use less than an inch. If you have an infant, you're not going to use a whole inch. You may not even just put it, you may only put it in halfway. So you have to decide your size and how you're going to give that injection based on your patient's body habitus. The gauge is 22 to 25. The angle is going to be 90 degrees because that'll ensure that we get you straight into the muscle. Dosage is usually between 2 and 5 milliliters. I put a star here that says infants under 18 months, you only use the outer thigh or vastus lateralis site. You're only going to use that outer thigh on an infant. Some examples of medications or vaccines that are given this way. The flu vaccine, the COVID vaccine is going to be given this way. Hep B, pain medication. So pain medication, even steroids are put into the buttock area. So they'll give you like a steroid injection that you can give in the back. So I can write that on here too, steroids. Because that's something that is pretty common to give, especially if you are, especially if you're working in like an urgent care, you may be giving quite a few steroid injections because people will come in with like a pulled muscle or some type of injured, like if they injured their back or their hip flexor or something, and the doctor may order a steroid shot that you can give. Okay, so these are your notes. Okay, I'm also going to upload a document that has the different injections, the recommended angles and needles. And then I also have a document of, here, I'll share it with you for a second. That is pretty useful. I'm going to move over here now. It is pretty useful. So this one has the different types of needles and syringes, and it kind of shows how it's being held. And then when you move down, I have some pictures of the actual syringe and it's labeled. So the needle length is your needle, the gauge is the diameter, and the syringe size is just based on the syringe here. When you look at the anatomy of the syringe, you are going to have to know what the plunger is. You are going to have to know where the tip is, where the volume markings are, what the barrel is, what the flange is. So you're going to need to know this because they may ask you a question in your CCMA questions, and you may use this terminology. So if you understand like the parts of the syringe, then you should be able to understand how to give an injection or what they're asking in that question. Okay, so I have some needles set up. I'm just going to pause for a second to get the computer ready. I'm going to stop sharing for a minute. And I wonder if it'll let me pause. Yes. Okay, so I have a couple things set up. I have my tray set up over here. It's kind of hard to see, but I have a tray set up. And on the tray, I just put some different needle sizes. and I filled them up with like a yellow liquid so that you could see it. And I put some gauze and some Band-Aids out. But I'm set up here to show you first the intradermal, and I'm going to try to get close so that you can see it. So when you are doing the intradermal injection, you want to go in the forearm area here. So if I roll up my sleeve, I'm not going to actually inject myself, but you're going to go in this area right here. Usually it's about 3 or 4 fingers below the bend of the arm and about 3 or 4 fingers above the wrist. So that's kind of like meatier part. You don't want to go over a tattoo because it will bring in some of that dye or the ink in with it if you go right through the tattoo. If someone is completely tatted up, both forearms, you might have to find another site. Sometimes you can use the back or the back of the arm, but you want to go in this area here and you want to try not to hit a blood vessel. So I always kind of aim for this side. I don't know why. It's just more comfortable for me to kind of aim on this side here where it's kind of fattier. So let's pretend that this is my arm, okay? First thing you're going to do is you're going to take your alcohol pad and you're going to wipe off the area, and you want to wipe it off in circular motions, and you want to let it air dry. You don't want to wave it. You don't want to blow on it. You want to let it air dry. And you're actually going to kind of grab the arm and hold it steady. So I'm going to grab this and hold it steady. I don't know how much of a wheel it's going to show me on here, but that's how I'm going to hold it. So I have my needle and my syringe. This is filled up to, I don't know if you can see it or not, it's 0.1. It might be kind of hard to see because of the glare. But when you take the cap off your needles, sometimes these TB tests will be pre-filled. Allergy tests will be pre-filled. You may not have to mix or fill them yourself, but you want to take the cap off sideways so that you don't risk sticking yourself. And you want to hold it so that you have a free finger to plunge with. Now there's different ways to hold your needle. Sometimes you can hold it and plunge it this way. Sometimes I just hold it this way because I have like full control over the needle because I have 4 fingers on it and I have one that's sticking out. You also want to look at the bevel at the tip of the needle and make sure that the bevel is up. Now it's going to be very hard to see on here, but you want to make sure that the bevel is up. You want to hold on to the arm and you want to take your needle and just slightly put it underneath the skin so that it's just under the skin, and then you inject your medicine. And it's going to leak because this thing has been poked a million times. So you're just going right underneath the skin. You're going to immediately click your needle closed and throw it out. You do not put a Band-Aid over someone who had an intradermal injection. You just want to dab it just to make sure nothing's leaking down their arm. And then you tell them that they have to get that checked within 48 hours. So it's just right underneath the skin. You kind of hold the arm like this, and your angle is about 10 to 15 degrees. Okay. So now that I have this baby here, we talked about babies and using the vastus lateralis. That's the outer thigh here. So if you are doing an injection on the outer thigh on the baby, you're going to have the parent help you, and the parent's going to hold the child, and you're going to prepare. So you're going to just wipe off the baby's outer thigh. You're going to have a Band-Aid ready, and you're going to have some gauze ready, and you want to hold the thigh and pinch it. And when you're injecting, when you're giving a vaccine to an infant, you are going straight in. Okay, so I don't know if that's like hard to see or not, but you're kind of going straight into the thigh. And you want to pinch the thigh. I won't be able to put the needle in because it's plastic, but I'll just kind of simulate. You just go straight in, and then you would plunge it in. But you'd have this gauze ready so that when you took out the needle, you can immediately cover the spot and get the Band-Aid ready. And then you would click your needle closed and toss it. I'm going to use this on the mannequin over there, so I'm not going to click it closed yet. But that's how you would do an infant. and then you would just put your Band-Aid over, okay? So moving on, I'm going to show you subcutaneous on the mannequin. She's laying on the table over here, and then I'll show you the deltoid or the vaccine in the arm. So I'm going to pause for a second so that I can get myself ready over there, and I'll be ready. Okay, so I'm back with my mannequin. I'm going to show you in the deltoid first, doing the intramuscular injection. That's the main site with like flu shots, vaccines that you're going to go. Okay, unless you're doing a cortisone shot, maybe a pain shot in the buttocks. But I'm going to show you the deltoid. So you want to make sure that you clean your patient off. So you're going to go from the middle out. Now the deltoid is the upper arm. The way that you get there is you usually put the top of your hand, you make a C and you come down, and you're going to inject in between your fingers here. You don't want to go too high up on the shoulder because you'll hit bone. You want to go more where the muscle, the meat of the muscle is. Now the syringe I have filled up, we don't have the 1 to 3 inch needles here, but usually it's going to be a dose bigger, like a 2 to 5 milliliter dose. I filled it up to 2, and this is actually a smaller needle than what you would use because we don't have the bigger needles here, but you would use a 1 to 3 inch needle, and you let that air dry. You want to make sure you have your sharps container, which I do right over here. You want to make sure that you have a piece of gauze ready and a Band-Aid ready, because usually we put a Band-Aid over these injections here. So you're going to take your needle off. You're going to squeeze the area, and you're just going to inject it like a dart. You do want to make sure that your bevel is up again, okay? So you're just going straight in, and you're injecting it straight into the muscle. You're pulling it straight out the way that you put it in. So you're going to get your gauze ready. You're going to pull it out, cover with your gauze. You're going to click this. So you guys all know how to click your needle, and you're going to dispose of your needle. You want to kind of massage the area a little bit. It kind of helps distribute it and not bruise as bad. And then you want to take your Band-Aid and place your Band-Aid on your patient, unless they tell you they don't want one, but I usually put one on, and just put your Band-Aid over, and then you're good to go. You will have to give the patient some instructions. When the patient leaves after they've had a flu shot done or after they had some type of injection done, like a vaccination, they usually get a pamphlet or a piece of like a handout or something that they can go home with. You always want to make sure you let them know. Call us if you have any side effects, any itching, any burning, any severe pain, fever. If it's severe enough, you feel like you can't breathe, or you have a really high fever, go to the hospital. You want to kind of tell them that they're going to be sore at the site as well, because they'll be sore at the injection site. So that is when you're doing it into the deltoid muscle. Now you can also do, bring your arm up. In the back here, this would be where you would place it in the ventrogluteal area, kind of like the top of the hip, the top of the buttocks area, right in here. You could do the ejection in here as well, okay? Or again, for infants, you want to do the outer thigh, okay? So that would be your intramuscular injection. When you're doing sub-Q, you would do the back of the arm here, or you can do the abdomen, or you can do the thigh, okay? So the abdomen doesn't have like a little squishy part that I can inject into, but you would pinch the abdomen and you would inject it into the abdomen. Or you would pinch the back of the arm here and you would inject it into the arm. The way that you would hold your needle, I have a needle filled up again, and this needle I have filled up to 1 milliliter, and this needle is the 5/8 of an inch. So you're just going to take your cap off, But when you're choosing your site, if I'm going to do the back of the arm here, I'm going to wipe off the back of the arm. So I'm going to take the back of the arm and I'm going to wipe it off. I'm going to let the back of the arm air dry. You're actually going to hold it at a 45 degrees. So you're kind of going in at an angle. You're not going straight. You're going in at an angle and you're squeezing the back of the arm and putting it in that way and injecting it. Now this one, you can dab off with your gauze and you can give them a Band-Aid if they want to. I'm going to show you in the outer thigh just because it's a little bit easier on her to do that because she has a place to inject it. So I'm going to turn this to the outer thigh. So same thing what I would do. I'm going to find the area on the outer thigh. I'm going to clean it with circular motion. I'm going to let it air dry. I'm going to have my gauze ready in my hands. I have my needle ready. I'm going to hold this outer area and squeeze it. Now I'm going up at an angle. So I'm going 45 degrees. I'm not going straight into the muscle of the thigh. I'm going into the fatty layer. So I'm actually going to make sure my bevel is up. I'm going to inject in. I'm going to inject my medication, pull my needle straight out, hold on to this with my gauze, click my needle closed, and pitch it. Okay. So those are all of your injections. Again, I'm going to put that handout or that document that I have into your announcements. This recording is going to be under live recordings, and I'll give you a reminder in your announcements to go look for it. It's going to be dated with today's date. Today's Tuesday the 15th, and I'll title it Injections. So you can watch this as many times as you want. The important information you need to know is your needle size, your gauge size, what we're injecting with each different type of injection, and the angle that we're holding it. And it's good to see these done because when you go into the field, you're going to be expected to know how to give an intradermal, a subcutaneous, or an intramuscular injection. But if you guys have any other questions, please let me know, and I will see you guys on Zoom tomorrow. Okay, have a good one.